Did you know that your biggest chance of having a cesarean has nothing to do with your health, your socioeconomic background, or your family history? The biggest determining factor is your choice in care providers. So let's take a look at some ways to make sure that you pick the right care provider for your birth. Welcome, I'm Ellen Contard.
And I'm Melissa Evans.
We've been supporting growing families for a long time.
We've come to realize that quality childbirth classes are really hard for growing families today, both in terms of calendar and budget.
So we've decided to do something revolutionary. We are offering our full, comprehensive childbirth class series right here.
Please realize that we are not medical providers nor attorneys. We do not practice medicine nor the law.
So use common sense and talk things over with a professional that you trust. But for now, let's get to a key starting point: how to pick a great care provider. There are 4 main types of care providers who catch babies in the United States: an obstetrician, or OB, a family practice doctor, who could be a medical doctor, an MD, or a doctor of osteopathy, a DO, a certified nurse midwife, or CNM, and a certified professional midwife, or CPM.
Please know that an obstetrician is a surgical specialty by definition. Family practice medical doctors may or may not be able to perform a cesarean if it becomes necessary, depending upon their training. A certified nurse midwife is typically someone who went to nursing school first. They are an RN who took an additional 2 years of schooling specific to midwifery, whereas a certified professional midwife didn't do the nursing thing first. They simply studied midwifery via school and or apprenticeship. In general, certified nurse midwives can catch in hospitals, potentially birth centers if they're available in your state, and maybe at home. These laws will of course vary based on what state you live in. Whereas certified professional midwives do not have hospital privileges. They are simply home birth midwives.
For the record, the word midwife literally means with woman, not I am a woman. So it's completely possible to have a male midwife.
I know the first time my friend mentioned that she hired a midwife for her birth, my first thought was, and what century is this? But no, really, midwives are experts at providing care for normal, low-risk women, and their care tends to be very specialized and personalized.
Please don't assume that just because an OB has been hired, you're automatically safe and don't need to assume any further responsibility for your birth.
I found this book in a free pile, thankfully, and it's basically a glossary of pregnancy-related terms. So, if one were to look up obstetrician, one would find this, and this is the entire entry. Obstetrician gynecologist. This is a medical doctor, surgeon, again, by definition, who specializes in the reproductive health of women. Check with your obstetrician's policy regarding natural labor, use of episiotomy, and pain relief. Whereas if we were to flip to the section on midwifery, it's much longer. I'm only going to read part of it to you. Because your life and the life of your baby is in her hands, choose your midwife carefully. Check her references. I'm going to argue that it doesn't matter what type of care provider that you have hired, whether it be an obstetrician, family doctor, or a midwife. You are putting your life and the life of your baby in that person's hands. Regardless of their credentials, check their references.
Care providers come with one of 2 basic philosophies. There's the medical model, which views a birthing woman as an emergency waiting to happen, and the care provider is there to fix the things that go wrong. Or there's the midwifery model, which views the birthing woman as a normal, healthy human being who just happens to be having a baby.
Just because one is referred to as the medical model and the other one is the midwifery model does not mean that all obstetricians see bombs waiting to explode, and not all midwives see unicorns and rainbows. Stereotypes don't serve us.
In general, though, care providers who operate under the midwifery model tend to be more patient, and they use lower tech approaches and only reach for those bigger interventions when it's truly necessary. They're experts in what's normal and the variations thereof, And so they're more likely to know when things are not normal and when those bigger tools are truly needed.
Care providers come with their own toolbox, one might say, and this toolbox can have a very direct impact on your birth. So let's say, for example, your baby happens to be posterior. Does your care provider know about TENS units?
Position changes,
Water therapy,
optimal fetal positioning techniques,
sterile water injections,
homeopathy,
essential oils,
acupressure.
or do they simply offer epidurals and cesareans? If the only tools that your care provider has are knives and needles, how do you feel about that? Is that what you want?
The number one factor in your chance of a surgical birth has nothing to do with your body. If your care provider's cesarean rate is 50%, flip a coin. That's your chance of ending up in the operating room.
Many pregnant women will talk to their girlfriends about who they hired for their birth, and that is sometimes the only research that they do. But what if your friend wanted that epidural right away and you wanted a natural birth, or vice versa? Then that care provider who is such an awesome fit for them might not be the best choice for your birth and what you want.
Remember, there are OBs and there are SOBs. There are midwives, medwives, and madwives. So choose wisely. The Coalition for the Improvement of Maternity Services, or KIMS, has a list of 10 questions that you can use to get a better idea of what kind of provider you're dealing with. We have a link to those questions below, so be sure to check them out and see what kind of care provider you have, or use it in the hiring of a potential care provider.
In fact, we think it's a really good idea to interview 3 more care providers: an OB or family practice medical doctor, a certified nurse midwife, and a certified professional midwife. And if all you learn is that you are head over heels in love with your care provider, then perfect. That's what we want you to know without any doubts.
Some red flags. If your care provider starts talking about induction in your normal and healthy second trimester, that's a bad sign.
You are an adult, a competent one. You do not need somebody's permission. You do need somebody's expertise in a discussion to help you make decisions. So if your doctor starts telling you that they won't let you do something, that's a bad sign.
If your care provider cannot, will not, does not take the time to address your concerns and answer your questions, that's a bad sign.
If your care provider gets concerned about your weight but never talks to you about nutrition, that's a bad sign.
If you decline a test or a procedure and your care provider cannot respect your decision, that's a bad sign.
If your care provider decides to strip your membranes without talking to you first, that's a really bad sign.
If you feel like you're walking into a debate or you have to come armed with studies to protect yourself, that's a bad sign.
If your care provider tells you that right after baby's born that they will have to keep baby below the placenta to keep all the blood from rushing from the baby back into your body, that's a really bad sign.
And if some concerns do pop up, please know that you can always change care providers. We've seen so many women stay with unsupportive care providers despite the red flags, and their primary reason was that they didn't want to hurt the care provider's feelings. Trust me, that care provider will forget you in pretty short order. You will remember your birth and the way that you were treated for as long as you're drawing breath.
So when is it too late to change care providers if that's what you decide you need? Well, if you're still pregnant, you still have time. And yeah, that means even in labor. Wouldn't really suggest it in labor. It's a little bit nicer to have someone known and an actual relationship of mutual trust. But you are always in control. It's your body and your birth.
The World Health Organization, or the WHO, recommends a 10 to 15% cesarean rate. Any less than that, and there are babies that could be saved by the technology that aren't. Any more than that, and we're hitting the law of diminishing returns and actually harming mothers and babies. To be honest, the US's average cesarean rate is closer to 1 in 3. More than double the upper limit recommended by the World Health Organization. Understand that the US is a very large country and geographically varied, so the local cesarean rate may be lower or higher. Our maternal and infant mortality rates are showing this. The sad fact is that we spend more money than any other developed nation, and our maternal and infant morbidity and mortality rates are the worst.
Another major homework assignment we have for you is to find out your care provider's rates of cesarean and induction. Please don't accept just when necessary, because they have the numbers. And quite frankly, if they won't give them to you, it's kind of another red flag. Consider all of the effort that you put into researching buying a new car or even a crib. More than that level of effort should be put into picking the right care provider for you.
And when you do find that care provider who respects you, supports you, and works with you, then trust them. Remember that you're on the same team. You've hired this care provider for their expertise in women's and infants' health, and you are the expert on your body and your baby.
We hope this has been helpful as you make one of the first and most important decisions for your pregnancy and your birth. So what do you think? What do you love about your care provider? Do you have any concerns? Let us know in the comments. We really do read them, and we look forward to hearing about your experience.
Please like this video and share it with all your expecting friends. And do subscribe. We'll be posting new classes every Tuesday and Friday, and we wouldn't want you to miss out.
Until next time,
Know your options.
own your birth.